Hi, I'm Carolyn and this is my dog, Sasha. She is going to be 2 in a few months. So she is young for a therapy dog, but we would like to share with you what she does and how she accomplishes this. I've always wanted a therapy dog, and when I got this puppy, I realized that her disposition was wonderful. She was very calm, very low-key, very mellow, and very receptive to training. So we started training at about 3 months, and she went through a couple of puppy classes at Petco and did really well. We then had some individualized training from that instructor, and we realized that she probably needed to be socialized with other dogs, that would be really important, you know, in her future. So luckily in our neighborhood we have a dog club, and she got to play and run and interact with dogs of all sizes and breeds and mixes and dispositions, and so she's very comfortable around dogs and cats. She has 2 kitties at home, and she loves people. So this seemed to make a really good combination for her beginning as a therapy dog. We enrolled Sasha, once we became serious, we enrolled Sasha in Canines for Christ, which is a training organization for therapy dogs, though they also do regular training, but they also do the testing, which is important. A dog has to pass a certain skill level in order to become a therapy dog, and so they need to be tested, and they then qualify for the Canine Good Citizen certification, which allows them to go into institutions, organizations, schools, mental health groups, hospitals, retirement homes, retirement centers, airports, and colleges that like to use therapy dogs for their students who are going through exam time and may become very stressed. So there's quite a need for therapy dogs at many different levels and many different abilities. Again, having a mellow, receptive, and friendly dog is important, and a dog that's easily trained. In Canines for Christ, the skills that we really concentrated on were following the human that they are working with at a very close side, turning, staying close, sitting, down stay, or a sit stay. Also having the human being able to put their dog in a stay and walk away is very important. One of the most important skills is leave it. And that's because you never know what's going to be on the floor in a hospital or a school setting, and you don't want your dog eating things off the floor. So that leave it becomes a very important skill. They weave in and out of posts just so they learn to stay close at your side and not drift away, and to be non-reactive to sudden sounds or noises or equipment, because they're going to be around, you know, machines cleaning the floor in the hospital. They're going to be around walkers and wheelchairs, very comfortable in that setting. And practicing consistency. So they need to respond to those commands regularly. The organization doing the training will most likely help you find institutions, situations, organizations that are interested in therapy dogs. So you may have places of your own in mind, but they can also help you find places and to know where to go for therapy work. Canines for Christ is really nice because they allow you to come back at any time for a little refresher work. We might be due for a little refresher work soon. It's always nice to have that opportunity to refresh those skills. Sasha volunteers at Knoll Retirement Center. She works in the memory care unit and hospice, and on the floor where the folks are all in wheelchairs. She's very comfortable with all of these friends that she's made. One of the memory care patients even remembers her name. So you will find that you are in situations that are just so touching and so rewarding. This has been a wonderful opportunity for both Sasha and myself. She loves going to visit her friends. She knows that when that vest goes on, she has a job to do, and she is so excited. She gets in a building and she goes up to everyone because she is there to brighten everyone's day. She's very patient. She will either sit or stand next to the bed or the wheelchair and allow the patients to love and hug and pet her and talk to her. And some of them don't talk, but that's okay. They have their way of showing their affection, and she's very receptive to that, and she's very patient, with their needs. She has developed such a rapport because we go back week after week and see the same patients. So she really looks forward to seeing her friends and seeing how they're doing. And sometimes they're not feeling up to visits, and we just say, we'll see you next week, and we move on. And Sasha seems to understand that. We also go to Jewish Hospital, and there are 3 floors there that we visit, and we knock on the door and always ask if they, would like a therapy dog visit. Sometimes they are not up to it, and sometimes they're very receptive. But it's also important to visit with the staff because they enjoy that uplifting moment and that chance to relax a little bit and be with the dog. Sasha, can you sit? Sasha, sit. Good girl. Good girl. This has probably been one of the most rewarding things I've done in my retirement. I've always had dogs. I've been involved with dogs. I've been involved with a shelter and rescuing. But there's something about therapy work that really just touches your soul. So if you are interested, I encourage you to follow through on that because there is a need, and it is wonderful to see how these dogs who have such a mission follow through and are able to give their love and kindness and patience to people who are really in need.